conservationist every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on WeFM 99.9 because your health matters.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Good evening. Good evening to all listeners of Your Health Matters. I want to apologize about last week. I was actually out of the country and, the time difference and so forth didn't quite make the connection I wanted to make to get on the program. But listen, I'm back. I'm here with St. Vincent. And remember, I think that every month now, I'm going to throw things a little more out to you, at least 1 week. The program is we talk about the subject and we open up the lines. And maybe sometimes we open up the lines just a little bit too late. A number of people have been sending me different messages. I've got a whole file full of questions people have been asking me. Some of them are the same questions or similar. And we got to try and piece through some of those things. But anybody who wants to just ask a simple question, something they heard that they ain't sure about, don't worry. It seems so important to ask about these things. Is a medication that you have or somebody's recommending that someone sent down to you from the States, said you try this, try that. And you ain't sure and you've been trying to look it up and you ain't really sure, but they're telling you try this or try that. You could always call and ask and so forth. Now we're going to get another email and so for you that you could send some additional question. We launch that next week. And we will allow you that if you are not a person who likes to call in to the program, you could always text or email us, but more preferable, so that we could prepare. The next week, we will look to answer your question. I got a pile of them already, but we will always take new, fresh questions, and we will try and answer those burning questions that you have. Anytime in the program, you could make a call, remember 457-9997, or WhatsApp a message, text, and so forth, 457-9997. Certainly if you call, someone may recognize your voice and so forth, and so that's fine. If you don't, you could just text and so forth, and we try and answer your question, and that confidentiality will be there. And I am sure you could be asking a question that a couple of hundred other persons are asking too. So this program, we're going to open up the lines early, but I want to talk a little about a subject. And I do not want to imply anything. We have been seeing recently one or two, I don't want to say a large number, of individuals who have either drowned or have either died as a result of being at a function, a party. There's no evidence or indication that it is as a result of alcohol, but alcohol is one of the big things. And I'm going to be doing a short program, right, later on, a more in-depth program on alcohol. I want to do a program on crack cocaine because, boy, crack cocaine, I remember when I practiced in the United States during the late 80s and during the 90s, crack was just everywhere in New York. A lot of young black people and older people on crack cocaine. And really, it's something that sometimes there's very little comeback. There's very little ability to pull an individual back once they're addicted to that particular drug. And crack is different from cocaine. Crack cocaine is different from cocaine, you know? But in addition, there's all sorts of prescription pills. Somebody can go to a doctor and they're in pain. Let me tell you, footballers, soccer players, American football, they might have been injured. Rugby players might have been injured, bruised the bone, you could say. And the pain is hurting them. And they're given some of these powerful medication. And it eases the situation. But the pain often comes back and they want the relief. So they get more of these tablets, these prescription tablets, not realizing the prescription tablet is making them addicted. And after trying to come off of the prescription tablets, they find that their brain is craving for more of the tablets. So they get it. They go back to the doctor and say, "Doctor, boy, I'm still in pain." But they're not really in so much pain, but they love the feeling that they have. And they basically get addicted. They get what's called dependent. That when they stop taking the medication or when the medication run out, their body starts to behave in a very funny way. And we're going to talk a little more about those particular type of things, because this not only affects young people, it affects the elderly. People who are on some powerful medication for arthritis or so, back pain, but the medication is just too powerful for them. They get ease, but boy, they have to be on the medication. So today, I want to start off for the first 50 minutes, before we open up the line, to talk a little about alcohol intoxication. Remember 4579997, both direct calls or WhatsApp calls. You know, join us. Put that question, write a question down, you know, and then just ask it. You know, don't feel in any way that the question, somebody may think the question is off. You just ask a question. That's something that's burning yourself. You know, we will treat that question with respect and so. Now, alcohol. Do you know, many islands in the Caribbean, we have a love affair with alcohol because we got some brands. I mean, Captain Morgan, you know, Cox, Spur, Monge, you know, they have a whole range of them. In Trinidad, in Grenada, each island has a particular brand that people tend to say it's the best. And somehow, you know, some people think Sunset is the best. Kamal, Kamal, you say you don't. You say that too fast, man. You know, you I'm sure you've been a rum drinker at one point in time. No, Kamal says he's never been a rum drinker. But alcohol intoxication impairs various functions, leading to noticeable changes in behavior, your ability to coordinate your movement and the way your muscles function, as well as your ability to think and your brain to function. We call that last thing here your cognitive abilities, COGNITIV, your cognitive abilities. That is your ability to think and reason and the inhibitions you have to do the right thing. Alcohol can impair that in your brain. In addition to coordination, lifting up this cell phone, lifting up a glass, driving, turning a steering wheel, you know, alcohol can affect it. We're going to go through this thing. Now, it can also alter your mood. Whether alcohol is going to elevate your mood or whether alcohol is going to depress your mood. You know, now, as consumption, as your increased drinking increases, as the amount of alcohol you consume increases, the symptoms can progress. You know, besides it reducing besides changing your behavior, your mood, besides the coordination, besides the ability of cognitive function, as you increase the amount of alcohol, right, it can produce slurred speech. The intoxication can later on lead to a loss of consciousness, and it can then cause what we call respiratory depression, where your ability to breathe becomes depressed, and ultimately it can lead to death. Now, here's a more detailed breakdown. And so the early effect of a low level of blood alcohol in your content, we call blood alcohol content BAC, BAC, blood alcohol content. And the different ways we can do that, you know, sometimes we could test to see how much alcohol you have in your blood, you know, at any given point in time. Matter of fact, police in some countries could do it just by have you breathe it into a bag, and it's not taking blood, but that could translate into how much alcohol you have in your blood just by breathing into a bag, and it's able to pick up the amount of alcohol that you have in your system, and by secondary extension, know how much alcohol you have in your blood. A blood test can be taken and can be sent to the lab to check and see how much alcohol is in your blood. We could do that, you know? But if you have a low blood alcohol content, this is how it starts in the early stages. It alters your mood and causes relaxation. Individuals may feel more talkative, you know? They may even feel more confident and relaxed. Everybody agrees with that. You know, that's something we know alcohol does. And I see this on the radio, and you want to go and talk to them. You may take a drink that relaxes you, makes you more confident, and makes you more talkative. Now, we hope that making you more talkative at the stage of low alcohol, blood alcohol content, you're not necessarily going to talk nonsense, but you can be a little more talkative. And this is true. So it alters your mood and gives you relaxation. Relaxation means that your body's not tense, you're not fearful, you're not frightened. It's able to relax you so that you are more confident. These are facts. This is reality. But it does also affect and cause some impaired judgment in your decision making. This can lead to risky behavior and poor choices. The alcohol also reduces your inhibitions. There's certain parts of the brain, I'm not going to tell you that the alcohol affects, and these parts of your brain are very important parts of your brain that help to inhibit you from doing things. If you're standing on the side of a road, going down on the leeward side, and you see the bank is there, and that bank, you know, we have some high banks. Is it going down Belial Hill, going down Chumaka Hill, or going across from Buckerman to Leyu? We got some high hills there. You may wonder, boy, I wonder what if I jump off of this ledge, if I will be all right. there is inhibitions in your brain that tells you, don't be stupid. You will not only hurt yourself, you could break a leg, you could die because of the distance you're going to fall. So we have natural inhibitions that tell us don't do things, you know? And alcohol can lessen those inhibitions and can make us take some real risky things. I'm talking about early low alcohol blood levels, blood alcohol content being low. You could have taken just a couple of drinks and you decide you are driving, but someone drives up next to you with a pretty car and they rev out the engine a little bit and you rev out yours and they want to speed up and you don't want to let them pass, but you have a low alcohol blood level that is still impairing what you are doing. You know, you could get into some serious problems because even with low alcohol blood content, your coordination and the risk that you're going to take will clash together. Now, let's say if your alcohol content is moderate. Let's say you have taken 3 or 4 drinks, not 1 or 2, 3 or 4 drinks. And let's say the drink you've been taking is not just High Room Beer, but you have also taken some Sunset, some strong rum, you know? Well, you could start having some slurred speech and some impaired coordination. And this includes some difficulty walking, the impaired coordination, difficulty walking. And you have an unsteady gait. In other words, you're walking, you're not able to walk, you're finding you are shifting over a bit. You ain't falling over, but you know you have to try and keep your balance. We call it an unsteady gait, right? And your ability to hold things up, in other words, using your fingers, we call fine motor skills, the fine skills. Moving your arms and your legs is one thing, but moving your fingers, you know, can be impaired. Moving your eyes, your eyebrows and your eyelids and so forth. These things are difficult to control, you know? Now, you could now start having vision problems where your vision starts getting blurry. And do you know your ability to understand distance becomes impaired? We call it depth perception. Just what I was talking about, you standing on a cliff and you look down and you are 50 feet high, but it doesn't look like 50 feet. It looks like something you could make. It looks like 5 feet, but it's 50 feet. Or if you're driving and you see a car coming, you see the light, but you think that car is far away and you could overtake the car in front of you and get in front of that car because you have the time and the distance to do so. But your brain has assessed that incorrectly. And you don't realize that that is only 50, 60 feet, not 200, 300 feet. Your ability to understand depth perception is off. And you make that fatal mistake of trying to overtake that car and then getting into an ongoing collision, a head-on collision. Besides vision, you can have nausea and vomiting. These are the signs that the body is reacting to the excess alcohol. These are important signs. When you see somebody feeling nauseous, don't encourage them to drink anymore. The next step is vomiting. And then memory impairment. This is all from just moderately high alcohol levels, right? And this memory impairment can cause somebody to black out. In other words, a person just falls back on their chair and they go out for a little bit. You know? But blackout doesn't necessarily mean that somebody is totally out, but you know, their level of consciousness is reduced and can lead to blackout. And then usually the individual can't even recall events that are taking place around them. People who have been drinking moderate amount of alcohol sometimes cannot remember what has been going on around them. If they're at a show, if there was a little scuffle where somebody pushed somebody or somebody hit somebody, they can't even remember the whole event. And this is occurring while the individual is intoxicated. Now, let me go on. Severe effects of very high blood alcohol content. The blood alcohol content is now high. Now, you know, I'm not giving figures, right? But the blood alcohol content is high. Let's just say it's high. You've been drinking, you know, at least 3, 4, 6 packs. And 3 or 4, 3 for 10, right? You drank about 12 beers, 10 to 12 beers. Or you've had 5 to 6 drinks of strong rum. You can have loss of consciousness. Individuals may become unresponsive, and somebody even on shaking them can't arouse them. As doctors, we have certain methods we use to arouse people. We can use our fist and put it on their chest and press down on their chest. Or we could use certain other methods, I'm not going to mention them, to see if somebody is responsive. And we look to see if their eyes open. We look to see if they get up. You know? We look to see if they cry out. And we could assess their level of consciousness. People can have a loss of consciousness where there's no response at all. You know? They can have respiratory depression. Now, what I'm saying is their breathing has become shallow. It isn't that the breathing has stopped. Their breathing is shallow. Down to, normally we breathe at about 16 breaths a minute. When their breath is now down to 6, 7, you know? And they air breathe and then they take another breath. Another breath after another 10 seconds. These are not good, you know, because then the amount of oxygen coming into your body is seriously low. And then the breathing could stop altogether. Imagine that. And can be life-threatening if no oxygen getting into your body. Your lungs, your muscles, and your brain is telling your lungs, just stop, relax. You ain't need to breathe, you know? You need to breathe. And you could go into what's called a coma and death from extremely high alcohol levels. The alcohol has suppressed the centers. There's a part of your brain back down to your neck. It's called the medulla oblongata. medulla. Let's call it the medulla. It controls your heart rate. It controls, that's your pulse. It controls your breathing. It controls your ability to vomit. Now, let me tell you something. When that part of the brain gets saturated like a sponge with alcohol, the blood alcohol level is high, your breathing is going to go almost down to zero. your pulse rate is going to slow down. You are potentially going into a coma and maybe even death. So what are the important considerations? Each individual is different. If somebody is big, 2 glasses of alcohol, intoxicating alcohol, may not touch them as much as if someone is a small 14-year-old child who is trying alcohol for the first time. We found that if somebody is a woman, the amount of alcohol you could take, Kamal, if you take alcohol and you are even though a low blood alcohol level, if you are a man, you could tolerate it more than if you were a woman of the same size. But if you were smaller, lighter weight individual, such as a young child, and you take alcohol, the alcohol is going to affect you more. That's why we don't give alcohol to kids. You know what I mean? And then somebody who could tolerate it. Kamal, if you haven't been a drinker, I want to tell you that you are probably less likely to tolerate alcohol than someone who has been a drinker most of the time. Now, that doesn't mean that someone who's a drinker could always hold their drink, because they drink more and they will go into the category of moderate alcohol, blood alcohol content, or even severe blood alcohol content and cause the problems. Now, there is the legal limit. The blood alcohol content should never be above 0.08%, right? That is the legal limit for driving. The legal limit for driving is 0.08%. So those persons living in America and so forth, you know that the individual will have devices, different things to breathe. They will test you. And so here in St. Vincent and in other parts of the world, we could do some other tests. We could ask you to touch your nose several times. We could ask you to walk a straight line and see if you could walk the straight line by holding your hands out. And if you can't walk that straight line and you're falling over, and if you are laughing, you're smiling, you know, then the police will consider that you are above the limit and they've done enough. They may not have to take a blood test to say that you're above 0.08. Some countries are like that. But, you know, they could tell if you've been drinking. Now, there can be something called alcohol poisoning. This is a serious condition that can occur when so much alcohol is consumed and it requires immediate medical attention. You need to go to casualty. We need to put up a drip. We need to flush water through your system to try and reduce your blood. You know what I'm saying? We got to put you on some drips, you know? And the long-term effect is of having regular heavy drinking is that the alcohol, you know, when you drink alcohol, you know what happens? You have a liver inside your body. And your liver has certain chemicals in it that can break down the alcohol. Break down the alcohol back to water. Imagine that. There are some enzymes in your liver that can break down the alcohol. But boy, if you have taken in a whole set of alcohol, those enzymes ain't enough. And the alcohol starts to damage the liver. Could damage the liver. It can cause your heart to start fluttering and get into funny heartbeats. It not only could suppress the rate, but it can make it go into funny heartbeats. And it can cause all kind of health issues. You could fall down, hit your head. break an arm, break a leg, falling in a gutter, do some stupidness, get into an accident. You could, if you're at the beach, you could decide, I go in for a swim because I am confident that I could still swim. But when the currents start to pull you, your muscles are, as I said, more relaxed. And your brain can't tell which direction you are in. Your breathing has become suppressed. You could be in serious problems unless there's somebody who is there to catch you and hold you. You could find yourself where you are unable to swim. Your muscles can't move. You know, it's a serious, serious problem. So I want to open the lines, as I said, for general questions. Call me on anything, right? 457-9997. And I should have announced this earlier. And so, the no necessary calls line. But I wanted to introduce this topic, and for us to understand that mild amount of alcohol can make us feel a little bit more confident, can reduce our inhibitions, can make us more talkative and more socially acceptable, that people will like us, we can crack a joke. But in truth, alcohol can have some major effect on our body. And let me just go over again. Alcohol affects our body very quickly. When you drink it, it's absorbed in your stomach very quickly, and it gets into your bloodstream. Once there, it can spread into the tissue. It doesn't just stay in your blood. It can spread into the tissue all over your body. Remember, your liver is trying to break down the alcohol and turn the alcohol back into simple water. But the amount of alcohol you take would have already gone into your muscles, would already gone into your lungs, would already gone into your brain, would have already gone into your heart. And alcohol reaches your brain in only 5 minutes after drinking it, and starts to affect your brain within 10 minutes. So you drink a good glass of 5 minutes later, it's reached your brain. 10 minutes later, you're now seeing the effect. And after 20 minutes, your liver starts to process to help convert the alcohol. But on average, the liver can only handle 1 ounce of alcohol every hour. Now, let's try to figure that out. I say 1 ounce, but it's difficult for me to talk about that because alcohol comes in different strengths. And so it isn't the amount of fluid in the glass, it's the amount of alcohol inside that fluid. So it may seem more, but if you have some rum punch, and the rum punch have a lot of juice in it, a lot of water, and it's mild rum punch, the amount of alcohol there will be small. But if somebody has gotten the real strong rum from Mount Bentic and pour that in, and the alcohol content is high, you taste it, but it smells like alcohol, but everybody drinking it, so you're drinking it, you are going to be consuming a lot of that alcohol, and it can become much more than an ounce you're drinking. You could be drinking 2, 3, 4 ounces. So after 20 minutes, your liver starts to process the alcohol. And on average, the liver can metabolize and break down 1 ounce of alcohol every hour. So if you've taken 2 ounces, it will take you 2 hours to break down that alcohol. A blood alcohol level of 0.08 is the legal limit for drinking anywhere in the world, right? And it takes around 5.5 hours for all the alcohol to leave your system. You know? So I'm giving you a whole set of facts. 5 minutes, the alcohol has reached your brain. 10 minutes, it starts to take effect. After 20 minutes, your liver kicks into gear and starts to convert the alcohol back into water. The liver's trying to help you. The liver's trying to help you. But if you have a bad liver to begin with, if you have a liver that ain't nice, that you've been treating badly over the years, matter of fact, if you've been an alcoholic and you've been damaging your liver, or worse, other things that could damage your liver, too much sugar over the years could have been damaging your liver. You hear that? Too much sugar over the years, like high fructose corn syrup, could be damaging your liver. So your liver can't process the alcohol properly. Even though it's kicked in 20 minutes, it can't even handle 1 ounce in an hour. So if you've taken 3, 4, 5 ounces of alcohol, your blood alcohol level is far higher than 0.08. If you stop taking the alcohol, even just with 1 ounce, it would take 5.5 hours to leave your system. That's why when you sleep and wake up, you could be okay. But if you have taken in 4, 5, 6, 7, 8 ounces, you may, 1, not wake up, or when you try to wake up, the alcohol is still in your system. The liver has not been able to process the alcohol. It can only process 1 ounce in an hour. So if you take 5 ounces, it will take 5 hours. If you take 10 ounces, it's going to take 10 hours if your liver is normal. You understand? Come on, you understand what I'm saying? So you go 9 mornings, right? Or carnival, let's say, and you've been drinking, and you're supposed to wake up for Juve. You ain't waking up for Juve. You know what I'm saying? That's why some people say, boy, I got to go around the clock, because they feel if they go to sleep, they ain't going to wake up on time. So after 20 minutes, your liver starts processing the alcohol, right? On average, the liver can metabolize, as I said, 1 ounce of alcohol per hour, and a blood level of 0.08, the legal limit, takes around 5.5 hours to leave your system. Once your blood level reaches to 0.08, the legal limit, above which you're considered to be intoxicated. Below, if you're 0.07, you got alcohol in your system, but we do not consider you as being intoxicated, you know? And we also know that alcohol is also getting into your urine. You are peeing it out too. Your liver's helping, but you're peeing it out. But alcohol can stay in your urine for up to 80 hours. And alcohol can stay inside your hair for 3 months. So, you know, if somebody dies, we find them somebody who's dead for a month. We could find out by doing tests on their hair to check their alcohol content, you know? And we can check and see, you know, what is going on. So intoxication occurs when alcohol intake exceeds your body's ability to get rid of it. Whether your liver's going to break it down or whether you're going to pee it out. Remember, peeing it out is slow. Remember I said it's going to take you about 80 hours. If some alcohol you drink goes into your hair, that's going to stay there for 3 months. You know, you could get a haircut. If I get like I need a haircut, right? Come on, you need a haircut too, right? You need a haircut too. We can cut off them locks there, man. What do you say, eh? Okay. But if Kamal, see me, my hair can't absorb so much of the alcohol. You have more hair than me, so you can absorb more. But boy, hair is not a great place, and urine is not a great place. It is the liver that you really want to break it down back to water. So you got to know that your whole body absorbs water, from your hair to your kidneys, to your liver, your muscles. And it really, though, takes the biggest toll on your brain. And so alcohol interferes with your brain's ability to communicate, the nerves, to coordinate your fingers, and to also to coordinate your judgment. And that's where you start doing stupid, risky things, you know? And, you know, let me just say, in terms of intoxication, there are some people, I would say the first stage of intoxication, right? We talked about your blood levels, but let's talk about intoxication. Let's say if your blood alcohol content is 0.08, but it's 0.01 or 0.05. I'm not talking about 0.08, right? Which is the level of you are illegal in having that alcohol content. Let's say you're legal, 0.01, 0.05. This is the first stage of intoxication. And you may not even look like you've been drinking. But as I mentioned to you, your reaction time is slow. If I raise my hand up, you know, you may not see it, and a few seconds later, guess what you're doing? A few seconds later, you're then moving away. But normally, you would have moved away. If a fly comes and land on your face, you noticing the fly has landed on your face or landed on your food, but your ability to swat the fly away will take a few seconds. So the fly has come on your food, and the fly has started to eat it and maybe drop some doo-doo on some droppings on your food too. And you're watching it, but it takes you a few seconds to respond to shoo the fly away, you know? So that you may not look like you've been drinking, but your reaction time, behavior, you know, and your judgment may be slightly altered. And this, of course, depends on your weight, on people, depending on their size and so forth, right? It's serious. So this is the early, we call subliminal intoxication. Then the next thing is you can go through euphoria. During the early stages of drinking, your brain releases a lot of substances from the alcohol. And I got to tell you what it is, called dopamine. D-O-P-A-M-I-N-E, dopamine. That's one of the big chemicals in your brain. And alcohol squeezes out some dopamine, right? I mean, I shouldn't say that. I mean, this is high science. But that dopamine, the chemical is linked to pleasure. Kamal, when dopamine is released from your brain, you feel more pleasure. The things that release dopamine causes pleasure. I gotta say this: sex, chocolate, sugars, being hugged, all these things help to release dopamine. Alcohol is one of those. So it's a fact. Alcohol could make you a little bit more euphoric. So during this euphoria, you feel relaxed and more confident, I said. But your reasoning and your memory are impaired. So on one hand, you're relaxed and more confident, which are positive things, but the downside is that you have these effects where your memory may be slightly impaired. This is where we say you're tipsy. You're tipsy. This stage occurs when your blood alcohol level is about 0.3 to 0.5. You also then have excitement, right? At this stage, your blood alcohol level is now 0.8 to 0.25. Your blood alcohol level is above the legal limit, right? You are now legally intoxicated with this excitement. The level of intoxication affects, almost all parts of your brain. Drinking too much can cause many of these side effects that affect the different parts of your brain. The front of your brain is control certain parts of your body. The back of your brain may control your vision and all that kind of thing. Other parts of your brain control your speech and your hearing. And you basically start to lose all these functions because those parts of the brain are saturated and soaked up, saturated with alcohol too. And it's above the legal limit. You may have, as I said, certain parts of your brain to the sides control your ability to use your hands, your motor skills. So that when you're driving or you're swimming, the alcohol ain't making you swim better and drive better. It's making you swim and drive worse. And worst of all, the alcohol could make you have big mood swings. You could have excitement, but then you could feel depression. You could start feeling low, right? And it could lead, as I said, to even nausea and vomiting. Another stage is confusion. And then when the alcohol level is really high, you basically start getting into what they call stupor, S-T-U-P-O-R. This is where you are having signs of the alcohol poisoning. Yes, when alcohol levels get up to 0.25, 0.3, I'm not talking about 0.08, I'm talking about, and I know these figures ain't gonna register too much. You really start to have poisoning. The liver can't break down all that alcohol. And the alcohol is having a chemical effect on certain parts of your brain and your body. All mental, physical, and sensory functions become now impaired. The risk of passing out, suffocation because you can't breathe. If you're in water, you may even start to swallow water and you're wondering what's going on because you can't breathe properly, and water is going to further affect you if you're swimming. That's why if you're in alcohol, boy, don't go anywhere near water. The water, if it gets into your system, is going to make you worse. And because when you're in water, you're breathing and your lungs remain full. Do you know when you're in water, the reason why you're able to float is because your lungs are full of air. But if your respiratory rate starts to go down and you're breathing, instead of 16 beats a minute, you now start to breathe 6 beats a minute. Your lungs is going to be empty at different times. You know, the air that you breathe in, and you're waiting for your brain to tell you to breathe in again, but it doesn't happen straight away. And 10 seconds go by, and then you breathe again. But during that time, your lungs are empty. You know what happens? You start to sink. Your weight is now heavier in the water because your lungs are no longer full of air. Kamal, you understand that? And you start to sink. And when you sink, you panic and you swallow water. And the water even makes you heavier. The water stops you from breathing. That's a serious thing. Ladies and gentlemen, we haven't had any calls, but we're going to push this out a little bit more, that anybody has any questions could call. I thought I would speak a little about alcohol. I do not want to imply that anyone who recently died at a party, whether on a beach or high in the mountains, in a village, that it was because they were drinking alcohol. Somebody may not be in the habit of drinking alcohol. And because it's a party, they're drinking alcohol for the first time. We say, come on, take one, take another one. We love to see people drink. We love to see people not inhibited and they're dancing. We love to see people enjoying themselves. But boy, these people have to get home. These people have to walk sometimes some very perilous pathways to get home. Sometimes there's no proper road. There's a pathway. They have to step down. But their body is impaired and they could likely fall. And worse, if they're at a beach swimming, boy, you can't do that. Ladies and gentlemen, I hope you have a better understanding of alcohol intoxication. And you be very, very careful yourself. This is Dr. Gerald Thompson signing out. Do have a good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs.